My name is Matt Curler, Vice President, Product Innovation with Surescripts, and I'm here today to talk about the Surescripts National Record Locator Service. So I don't think it's any surprise to anyone here today around the importance of being able to locate and exchange information in healthcare. That's the reason we're all here. If you went around the HIMSS floor and you ask people why they're here, I bet you could get at least half of the companies to say, we're here to help companies in healthcare exchange information. So let me just baseline a couple of key facts that I think are important. So first, 20% of preventable medical errors are a result of information not being available. 1 in 7 patient visits is impacted by missing information. And this is really why we are here today, and this is why I want to tell you about the Surescripts National Record Locator Service. Finding information about patients is critical. Locating those patients, exchanging information about those patients is a key part of what we need to do to transform the healthcare system. Frankly, though, the industry is not there. We are not in a position to meaningfully exchange information. Let's talk about a couple of the key issues. So first, you have all of these disparate systems. Patients move around the healthcare system. They have the ambulatory clinic. They may go to the ED. They may see their specialist and the cardiologist. And at each one of those phases, their information is being stored in these disparate systems, and those systems don't talk to each other. The exchange infrastructure in healthcare does not adequately connect those systems. We don't have the infrastructure that we need to connect all of that information. Additionally, there are a lot of cases where patients are providing information. We know that that information is not always accurate. It's certainly not always complete. And that kind of information is problematic when you're trying to build up a holistic view of a patient. Additionally, the manual methods that we have for today for locating information, exchanging information, it's costly, it's manual, it's time-consuming. And finally, as ACOs come into play, value-based purchasing, risk contracts, the need to exchange this information is just increasing, and we don't have the infrastructure we need to exchange it. Let me talk for a minute about why Surescripts is in a unique position to solve this problem. We have spent the last 14 years building a national infrastructure for exchanging information. We started out in exchanging electronic prescriptions. We moved into medication history. We then got into the exchange of immunization information with state registries. And finally, we have this national network of interoperability around direct messaging and clinical messaging. And those are just some of the examples. In 2014, we sent over 7 billion transactions. We have an MPI with 270 million unique patient identities covered lives that covers 230 unique patients. There were approximately 2 billion prescriptions that were exchanged. And we have the relationships with the EMR vendors, the pharmacies, the PBMs, and the other constituents in healthcare that allow us to connect all of that together. So let's talk about the reason we're here today. Let's talk about Surescripts National Record Locator Service. So this service is a service that allows our providers, our customers, to easily locate and exchange information about patients. Let's talk about that flow for a moment. So step 1 is identifying the patient. So the customer queries Surescripts, says, I'm interested in information about Matt Curler. Surescripts comes back and says, is this Matt Curler? Yes, it is. You then get information about the different locations that information about Matt Curler is available. So it may be the cardiologist down the street It may be the health system across town. It may be the clinic in Florida that I visited when I was there on vacation. You're then able to see the information that is available at those practice, look at a list of the documents, and bring those back into your EMR. All of this is done for those of you that are a little bit more on the nerdy side. A lot of this is done via the IHE standards. So it's a standards-based way of interacting with Surescripts. It's using XCPD, XCA, PLQ. What this means from a kind of an end user perspective is that physicians and health systems are able to find information about patients that they wouldn't have been able to get to otherwise. They're able to see that location information, see where that patient has been seen. They're able to retrieve that information and bring it back into the point of care. They're not having to use the manual methods of phone, fax, etc. It's automated. It's built into the EMR. It's not the fax. It's not the phone. That integration to the EMR into the point of care is critical. Let's walk through the workflow. We're going to go through a couple of different scenarios. So scenario one, patient arrives at the emergency room. The ED is interested in learning more about this patient. They ask them a couple of questions. They're not getting what they need. So they query Surescripts. They they match the patient. They request for the location information. They get that back. We provide the location information. And that gives the emergency room the ability to have a conversation with that patient about the fact that they were at the cardiologist 2 months ago. What does that mean? How does that impact their care? And then they're able to pull the actual relevant documents across into their EMR. They can get the summaries. They can get the lab results. The information that is stored in that system across back in Florida in our example, it can be pulled into the EMR in the emergency room. Let's talk about another example. Elderly woman comes into the ED with their family, and the ED needs that relevant patient information. It's not available. The patient doesn't remember the information. That medical history is not complete. They use Surescripts to figure out where they've been. They were at this woman was at a couple of different care centers, one in Florida, one in Wisconsin. They're able to pull that information, query those locations, get the documents back into the EMR, and really build out that complete view of the patient's history. So let's quickly recap what the Surescripts National Record Locator service is and what it does and what it enables. So it's a huge time savings. We hit on this a little bit. The fact that you're able to query for information, you're not making phone calls, you're not using the fax machine. There's the opportunity to really reduce the need for duplicative tests. You have access to those tests that occurred in other care settings. You're bringing that structured clinical information back into your EMR. You don't need to send the patient out for another test. It really strengthens patient engagement. The provider is able to have a meaningful conversation about the patient. They have some of the history. The patient isn't spending time providing that medical history. The physician and the patient are able to have the real conversation that needs to occur. Give me the details about this. They have the clinical information. They can get into that nuance, have that conversation. The patient satisfaction is also increased. The patient appreciates that their information is there in front of their provider. They're not being asked to provide the same information over again and over again. All of this drives interoperability. The fact that this information is moving around, the fact that the phone call isn't occurring, the fax isn't occurring, is driving interoperability in healthcare. All of that also streamlines care coordination. The information is available to the person that needs it when they need it. And finally, all of this is done in a way that is integrated in with the EMR. It's integrated in with the workflow. So in closing, a couple of key points before we jump into questions. We announced some partners that are doing this a little bit earlier in the week, and We are working with them to figure out the details of the implementation. We're going to be doing a series of webinars, so make sure that you look for those from your vendors, and that will talk through the details of the implementation and the rollout. Also, if you're interested in learning more about this service, make sure that you reach out to some of the Surescripts folks that are around here, get your badge scanned, and we can follow up with you. So with that, let's open it up to any questions. Say that again. That's a good question. So we have an MPI that resides kind of inside of it's based off of all the data that we have access to. So it's that patient demographic information that we're using to match the patient. And then the information that we're pulling, the clinical information that we're pulling across is coming from the other organizations that are participating on the network. So it's not Surescripts clinical data that folks have access to. It's the other participants on the network. It's their clinical data that these participants have access to. The MR is in the medical records? Yeah, so it's the clinical content. So it may be a summary CDA, it may be a particular document, it may be a lab result, it may be a consult report. So that clinical information is traversing the Surescripts network and ending up in the requesting system's clinical repository. Other questions? That's a good question. I'll have to get back to you on that. I mean, the front side of that, the key part of the workflow that matters in that particular scenario is on the patient matching. So you're going to request information for Matt Curler. They will come back with a couple of different Matt Curlers. So it's that part of the process where that QA really occurs.
And sometimes the patient actually has more than one record in one health system.
Thank you. I'm going to make you talk loudly.
So sometimes when they register a patient, in the past, they didn't necessarily have all the procedures in place to ensure they recognized that it was an existing patient.
Right.
So they sometimes will have more than one record for a patient in the medical record. How does this handle that?
Yeah, that's a good question. Good question. So there will be kind of multiple ways that you could query. So you could query multiple times. If you see that there are kind of 2 or 3 different instances of those patients that actually match the patient that's sitting in front of you, you would be able to query those individually. It may be a multi-step process, but because you're seeing the patient information associated with those 2 or 3 different scenarios, you would be able to pull that across.
Okay.
Do you have any consent issues that you have to deal with in providing this data to?
So the consent is really provided on the edge. So in the same way, in a lot of ways, kind of like Healthy Way works. So the consent is managed on the end systems that are connecting. So if that end system doesn't have the right to share information for a particular patient, it wouldn't be made available for sharing.
And do you have any responsibility to keep track of that, or is that you entrust the participants to only upload data they have consent to upload?
It's the latter. So they would only basically make information available that they have the consent to share. Yeah. Back to Randy. I'll just leave it with you.
Does the system provide an audit trail for where data came from and where it went to?
Yeah, there's a full audit trail for all of this information. I can get you the technical details on that. I don't know it off the top of my head, but the IHE standards provide full audit trail for this kind of information.
Okay, and if I've reached out and I've pulled the data in and there's a breach on my part, is the originating organization at all responsible for that?
So if
patient presents
you and you pulled information from me,
right, and then there's a breach on my side, is the originating organization at all responsible?
I don't believe so, but I would want to talk to our legal counsel on that one. I'm not familiar with the particulars of that law, so it's a good question, but I don't know the answer. Any other questions? Okay. Thank you very much.